Hello everyone, welcome to our show Ask Your Doctor. I'm your host Shivani Raj. So for today's show, we have Dr. Sonal Patel. She is double boarded in neurology with special qualification in child neurology and clinical neurophysiology. So without any further delay, let's welcome her on our board. She completed her undergraduate degree at Duke University and works with children most of the time. So yes, doctor, I hope you're doing well. How are you?
I'm doing great. Thank you so much, Shivani, for having me on your show today.
Yes, doctor, it's lovely having you on our show. I was hoping, can you introduce a little to the viewers watching the show right now? So we have a lot of South Asians watching our shows around the world. So maybe introduce a little about you and the work that you do.
Yes, so I am a pediatric neurologist and pediatric epileptologist. The kinds of cases that we generally see are anything ranging from seizure activity and epilepsy to headaches and migraines or tic disorder and Tourette syndrome, as well as developmental delay. Primarily anything neurologic we see in the office here. Our office is located in Bethesda, Maryland and McLean, Virginia.
Yes. So, doctor, I was reading about you and I got to know that you are specially trained to work with with children. So can you tell what exactly do you work as, how do you deal with children and what are some common problems that you deal with there in USA?
Yes, so we have specialized training during our residency in only pediatrics. So during those years, we are basically assuming the role of a pediatrician. And so we have extensive experience in all pediatric disorders. After that time, we move on to our pediatric neurology residency and fellowship, where we specialize in neurologic disorders, actually in adults and in children, so that we can combine that knowledge to apply to children. After that, I completed a fellowship in pediatric epilepsy, where we are trained in neurophysiology and the reading of EEG, electroencephalogram studies, as well as long-term video EEG monitoring studies.
Yes. So doctor, in the call, we had a call last time and then you did talk about, how you deal with different children. So what is the most common issue that parents, have with their children and they come to you? You did talk about how children go through seizures or headaches or migraine headaches. So we did have a conversation about that. So what is the most common issue that you deal with?
Yes, for me, because of my specialty, epilepsy and seizures are the most common thing that I see. And sometimes it's to rule out seizure activity. Was an episode indeed a seizure or not? Something may have happened where there was some altered awareness, and we are here to investigate and diagnose whether we think it was seizure or not. I would say the second most common thing we see are headaches and migraines. So these are children where they complain of an intense headache. They may have nausea and vomiting, also may have some vision changes, numbness or tingling. And those can be very severe episodes that are very concerning and can lead children to an emergency room or to see a neurologist, of course.
Yes. So doctor, this is a personal doubt that I just had. So is there a difference between an epilepsy and a seizure?
So epilepsy means you will have ongoing seizures. 50% of children with seizures will actually only have one seizure and may never have another seizure after that. So, if it is ongoing, that's when we call that epilepsy. But if it is just a one-time seizure, the event itself is just called a seizure.
Okay. So are there any symptoms that the parents have to, early symptoms that they have to recognize? So as a doctor, what is something that you can, that you can say that, this is how an epilepsy is diagnosed?
Absolutely. Wonderful questions. So yes, there is a test that we order if we are concerned about seizures. It's called an EEG, known as an electroencephalogram. And that study looks at the electric currents in our brain. It's similar to an EKG for the heart. And when we do those studies, we can see, is there any electric discharge that may be affecting the electric balance in the brain, ultimately leading to seizures. And as far as your second question, which was what signs or symptoms are we looking for? Typically the first sign or symptom we see is an altered awareness where patients are suddenly unresponsive or staring, dazing off, not seeming to have their normal activity. And suddenly they may fall to the ground. They may have shaking of the upper extremity, lower extremities. They may have difficulty speaking. They may have slurred speech, excess drool. They may have their eyes rolled open or staring straight ahead. Like I said, they may have a fall to the ground with possible loss of continence as well.
Doctor, how is it treated then? And also, like, what causes breakthrough seizures in otherwise well-controlled epilepsy? So can you explain a little about that?
Yes, absolutely. So, in terms of what may be the cause of seizures, it could be that they were born with a genetic issue causing seizures. And then, in terms of treatment, we have a number of medications that we can use to treat seizures based on what type of seizures we believe they have. And these days, there's also newer inventions for seizure control, including brain implants that we place so that patients can stop the seizure right when it starts. So there is a lot of new technology and innovation in seizure treatment.
Yes. So doctor, let's talk about migraines and headaches. When usually a child, let's think from, a parent's perspective. If a kid is naughty, they come say, oh my God, I'm getting headaches. Sometimes they do ignore it. But, when must a parent should think like, no, I think my kid is actually going through something, and come to you and can you also talk about why does these headaches happen at such a young age, being an adolescent itself? So why do you think it happens? And what are some things that you want to say to the parents watching the show right now?
Yes. So headaches, sometimes can seem very benign and part of childhood, but the times where headaches become dangerous are when they wake a patient out of sleep. That is definitely an indication to contact your physician or neurologist. The other is if they are having nausea or vomiting associated with the headache, or if they are having any altered awareness when they have a headache. Those would be the telltale signs that it's time to go see the neurologist, get an image or an EEG study if needed, and try to understand why these headaches have become so severe and are having other focal neurologic symptoms. And so that's when we would tell parents, contact your physician.
Yes. I was hoping, can you tell, as a doctor yourself, and can you talk a little about the foods? I'm pretty sure, some foods or the other foods can affect, directly or indirectly. So is there anything, some diet basis that you can suggest to the parents for their children, especially for people who are going with neurological terms, or should I get back to the question will food affect anything related to neurology?
Yes. So, foods can be a trigger for migraines. We do see food triggers more common in the adult population versus the pediatric population because many of the foods that trigger migraines are not things children consume, such as red wine or certain types of special cheeses or certain types of even MSG type products. So most kids are not consuming things like that. So food products not as big an issue. One food product, though, that we can see related to migraines, it can be something like chocolate. So chocolate has been known to be a pediatric migraine trigger. So that would be one where if you notice a child eats chocolate and then complains of a headache within the next 24 hours, we would say that may be a food trigger for you. More than food, though, what we see as a major trigger is dehydration. So kids that are not drinking enough water, that is one of the most common triggers where we see that affecting headaches and migraines. So one of the first things that we try is to monitor hydration and increase hydration. Just water is totally all that we need in those cases, but it is really important to monitor the amount and make sure that it's correct based on the weight for the child.
Anxiety, mental depression, these are all, of course, psychology related. But, there are sometimes that there are kids that, they are mentally low and, some people actually do connect it with neurology. So did you ever deal with a case related to that?
We do see the overlap of psychiatry with neurology, and mood can certainly affect our neurologic health. One of the things that we always look at is stress, and we do know children with stress can typically, produce headaches and migraines. That is one of the known triggers. So, an example would be when kids are studying for exams and they're under a lot of stress and pressure, and they suddenly develop headaches. That's a very common scenario for us.
Yes. So doctor, we as South Asians, we have homeopathy, we have Ayurveda, and there's some different, treatments that people can do. But, there's also something called where people just randomly use stuff and, it instead of helping you, it actually worsens it. So is there any way that people should, there are some things that parents especially should be away from, especially for their child's neurological health?
Yes, so that's a great point because you're absolutely right, that does happen. The good news is there are some very beneficial things that we can try that are natural treatments. One of them being vitamin B2, which is riboflavin, and that's been found in studies in the pediatric population to be very effective in reducing the frequency and severity of headaches and migraines. So that's definitely an approved thing that we would recommend. Some of the things that we get more concerned about are, just as you mentioned, certain vitamin supplements that we're not as familiar with. One of the ones in America that we used to use and now have been worried about things like liver issues are something called Butterbur. And we used to recommend it and now we don't because it's exactly what you mentioned, that it can cause some other systemic issues, including liver issues.
Yes. So doctor, as a neurologist, I know that the question that I'm asking you is a little related to psychiatrists, but is food and increasing your study and concentration, or just concentration in general, is it related? Because you see, even when I was young, my grandma used to give me badam and she would almonds, and she would say, Shivani, you're gonna get intelligent if you eat this, if you eat chawanprash, you'll be this and that. So is food anyhow related to good neurology, good neurological health?
So absolutely, there are some foods that certainly affect our neurologic health, including omega-3 supplements and foods high in omega-3. And so there are certain fats within things like almonds that are very helpful for our neurologic health. Almonds, but also things like fish, which certain South Asians do consume. And then, just taking a supplement in general, they do have vegetarian omega-3 supplements as well that can be very helpful. So things like chia seeds, also high in omega-3s, and so as well as flax seeds. So any of those we can use to improve our neurologic health, and that's for pediatrics and adults.
Yes. So doctor, this is a big argument that a lot of people have. We as South Asians, we as Indians, our culture, our food ways, the way that we eat, is equally praised and equally not praised. So people say that, oh my God, we have amazing foods. We have great foods like ghee. It's amazing for the health. But there are also a set of people who say, no, that's like the most unhealthiest thing that one can have. So as an Indian doctor that you are, and you also are very, how Indians deal with their food, and how the different Indians have different, we have rice every other day. South Asians have rice every other day. So according to you as a neurologist, what is a proper routine that a child must follow for great neurological health?
Yes, that's a great question because everything we consume does affect our health and our neurologic health. The way that we look at food groups is really important, where we, of course, want to have things like carbohydrates, which is rice, and potatoes. Those are very important for diet. But we also want to add things like protein, and that's whether it's in animal protein or possibly lentils or legumes. Those provide a lot of protein as well. And then, we, of course, look at vegetables, which is very common to most diets, but it especially important in an Indian diet because those do provide some extra supplements, the vegetables that maybe we aren't getting if we are not consuming animal products. So one example is like eating spinach and broccoli. Those green vegetables provide a lot of iron and other supplements that maybe we don't get if we don't consume red meat. And then fruits, of course, another great carb. So I think having a combination of healthy carbohydrates, including fruits, healthy protein ingestion, as well as fats, which can come from the form of things like avocados, almonds, nuts, anything like that. And those are all great for the brain.
Yes. So doctor, let's talk about ticks. Ticks are nowadays, I am pretty sure, like since 10 years, ticks have become a quite common issue between children, and also it is also common that people ignore it. People say that, oh, it's just playing. Just, this kid is acting a little weird. It's fine. He'll grow out of it. So as a doctor, is there anything that you want to talk about ticks, and can you explain why do ticks happen and what exactly are ticks?
Yes, so tics are an involuntary movement that children will make. It can be either a motor tic or a vocal tic. So something you can hear or a movement you can see. And so, you're right. Many parents will say, oh, it's nothing, or may not even notice, to be honest, until the kids get a little bit older. And it is a genetic disorder, meaning that kids are just born with it. Sometimes it runs in families. Sometimes the child may be the only person that may have it. Tics do have a waxing and waning feature where there are times where they are more prevalent. There are times where they are less prevalent. And, sometimes we may recommend medication. Sometimes we may recommend cognitive behavior therapy to help with the tics, to adjust them so they are less disruptive. The good news with tics is 70 to 80% of children with tics will actually outgrow it. And so that's part of why we don't always treat it. But if it is disruptive in a classroom, especially if it's, causing any social anxiety or stress because other children are teasing them, or if it is causing disruption, if it's a vocal tic and they're not able to stay in the classroom, those would definitely be times where we would want to consider treatment, including medication.
Yes, let's talk about epilepsy again. I just have a doubt. I did hear some stories about how they go through surgeries, and when must a surgery be done, and what kind of surgeries are they? Can you please explain that first?
Sure, yes. So there are more surgical procedures involved with epilepsy these days, which is fantastic if that's a possibility. And those are for patients where we've used our traditional medications and have failed, and where we do see that the seizures are coming from a certain region of the brain. Usually the tissue that seizures arrive from, if it is focal, it may not be functioning properly. So if it is removed, may not cause a big effect neurologically, but can stop the seizures. We do know that seizures can affect our neurologic health, and so it is important to stop seizures. So if medication alone is not working, we would work the patient up to see if they are a possible surgical candidate.
So yeah. But as a doctor, do you think these surgeries are like when must one actually consider surgery? And if they are doing a surgery, do they have any complications later in life?
Yeah, so part of when they do the workup, one of the things is to look for risk of later neurologic issues. So we, of course, wouldn't do it if we think it's going to affect speech or memory or any other neurologic function we need later in life. So that is part of the workup to see if that indeed is a possibility.
So doctor, can you talk a little about ADHD? What exactly is that?
So ADHD is where we have attention deficit hyperactivity disorder. So that is where kids are, a little more active than their peers, where they have difficulty focusing, difficulty with concentration, difficulty with sitting still in a classroom setting. They may have extra energy, which it makes it very difficult for them to pay attention and to focus. So some kids are just born with that, and there are definitely things we would want to do if that is affecting their learning.
So what exact treatments are like? What do you guys do when a child is diagnosed with ADHD? How do you treat them? In what ways do you treat them?
Yeah, so medication is definitely one of the primary ways that we treat kids with ADHD, but we also recommend things like executive function coaching. So the executive lobe, frontal lobe of our brain is where we, understand organization and how to prioritize certain things. And so executive function coaching can be a great supplement to medication.
Yes. So doctor, so this also is kind of related to psychology because you have to understand, what is the kid going through, and basically understand biologically about what happened, what is actually happening in their minds. I think this is another common question that parents have, is that the food isn't great. The food isn't great. Some kids are so specific about, okay, I want this, I want that. So is there any ways that you as a neurologist, I know this doesn't actually is not properly exactly related to you, but as a neurologist who studies brain, can you tell in what ways can parents incorporate all of these into their lifestyles?
Absolutely. So, sugar is something that we really look at in pediatrics, where we know excess sugar can actually cause hyperactivity, and that's in any child. So, if you are seeing that link, it's one of the things where we would want to reduce sugar intake. And so, of course, healthy fruits are reasonable, but we're talking about the produced products like cookies and ice cream and all of that extra sugar that kids are eating these days, where maybe we minimize that in patients where we see that direct effect of hyperactivity after consuming that.
Yes. So, doctor, can we talk a little about the Magnificent Minds of Neurology Center? So, what exactly happens here, and who all works with you, and what are some common treatments that you all treat?
Yes, so at our center, which is called Magnificent Minds Neurology Center, we see all of these disorders that we mentioned. Like I said, our specialty is epilepsy, so we do see patients with seizures, migraines, headaches, developmental delay, tics, Tourette syndrome, anything neurologic. We also see patients with concussions and head injuries, as well as children with brain tumors. So all of those things are what arrive in our office. Some of the testing that we perform here is EEG testing, electroencephalography, as well as ordering things like MRI studies or CT scans. And then, of course, we do lab work if needed. And then, treatments that we offer, mostly we offer medication treatments, but we also order certain types of cognitive behavior therapy if needed, executive function coaching if needed. And we do make recommendations for patients to see other specialists if that is warranted.
Yes. So, doctor, we did not cover something called as development delay. Remember, we did have a conversation on our phone where one of my neighbors, she couldn't speak for 4 years, and her parents were so worried. They had to go to every single doctor, and then they also went to neurologists. So, what are some development delays that parents should actually put in their minds and be like, no, this can be serious? And what are some things? What are some common myths that you go through? Okay, this is fine. What as a doctor can you say, no, this is fine, it can take time, you don't have to worry about it?
Yes, no, that's a great question, because there are certain milestones we expect children to meet. And if they don't, we would look into why they are not meeting those milestones and how we can help them meet those milestones. So one very common one is, we expect children to be walking typically by 15 months of age. If they are not walking by 18 months, that's a red flag where we would want to contact the pediatric neurologist. Another is speech. We do expect to have some words by 15 months of age. And then by 2 years of age, we expect them to be putting two words together. If we don't see that, again, another reason for investigation to see why that may be happening, and then a referral for speech therapy to help produce speech if that indeed is the issue. Fine motor skills such as writing typically occur later, but at younger ages, we're looking at things like pincer grasp, like can they hold their Cheerios? Can they hold a crayon to color? So if we see any issues with that too, we can always consult occupational therapy. So, based on what we see, if they are not reaching the appropriate milestones for age, we would recommend certain therapies to help them along. And we recommend a consultation with a neurologist so that we can see, is there a reason we are delayed on our milestones?
Yes. And finally, I think this question comes from every single South Asian parent here. Does mobile phone help or ruin your neurological health? Like, I think every parent should watch this and anything that you want to say as a neurologist finally?
Yes. We are finding in the youngest children that being excessively on a tablet or a phone or in front of screens does affect their speech. So, we go by the American Pediatric Society guidelines, which is no more than 2 hours of screen time after age 2. And prior to age 2, no screen time is what is recommended for speech development. So we go by those guidelines because we know that, we can have less progression in those milestones if we are stuck to a tablet or phone or screen prior to those ages.
Finally, doctor, is there anything that you want to say to the viewers watching the show right now?
No, I feel like we've covered the majority of neurologic conditions that come into us as a pediatric neurologist. And if you do, it's always better to be overly cautious than underly cautious and miss something. So always a great idea to consult your nearby neurologist if you do have any concerns or questions.
Thank you so much, Dr. Patel, for joining on to our show. It was amazing having you. We did cover a very important topic. I think the parents will be very excited to watch this. Thank you for the viewers for tuning in. You're watching Sakshi TV with me, Shivani Raj.